And this is the kingpin here. If I sound like I'm touting this drug, it may be the only one I'm going to tout today. I can't think if there's something else I'm going to tout. But this one, I will. It is a godsend to the treatment of mania. It can be a godsend to the treatment of bipolar as well as unipolar depression. But there is some specificity associated with it. I call it the gold standard because it is, and I do not believe anything is going to replace it. It's been the gold standard since the 1940s. All it is a salt that comes from rock in the ground. That's all it is. Its use was discovered by accident. People who had manic symptomatology back years and years, decades, eons ago, if I can just use that term, consumed this substance. Many people used it as a salt back then, and this behavior abated. There was no way to document that far before psychiatry reared its head, as a bona fide profession. So it's not that lithium is new. So it's best, this is important, it is best for a classic picture of manic depressive illness. Mike is as good a candidate as I can find for lithium. So, classic manic symptoms with a period of pseudo-normalcy in between, followed by an accompanying depressive episode, or a depressive episode associated with a period of pseudo-normalcy which is followed up by a manic episode or by another manic episode. It can come in all different little wavelengths right here. But it is a classic presentation of both ends of the spectrum. Lithium's excellent with that. As I just said, very important role in nonpolar depression as augmentation. Augmentation. You remember I discussed Abilify, I discussed lithium, I discussed thyroid supplementation. There are many other ways to approach treatment-resistant unipolar depression, but lithium certainly fits into that category too. Again, excellent for any patient with high suicide risk. I say again because I discussed that a bit earlier this morning. I do not know how this drug helps abate suicidal ideation, but it does. I have been asked this, and I do not believe what I'm going to say is true. I don't think lithium works on the depression at all. I think it works directly on the suicidal thinking and ideation. I can't prove it. I'm only offering you a theory. I know there are many noted scientists. I've checked. No one can give me a cogent answer because they don't know either and are willing to admit that. I'm going to have to accept right now that it simply does work and works beautifully. Anyone with a history of depression, with suicidal tendency, this is the hardest thing for me to do, is to get the treating physician to put them on lithium. Put them on lithium, we have cover. Absolutely have cover, and I pretty much swear by that in my practice. So, okay, fight or flight deactivator, that's what it does. How does lithium work? Not clear. I can make some guesses, but would I be clear enough to tell you what they are today? I do know this. It'll deactivate mania, and that whole fight or flight manic type response is curbed. It's slow. Lithium is not effective for rapid cycling bipolar disorder. You want to know that. Which means when we discuss kids tomorrow, for those of you coming back, most kids are rapid cyclers. Most kids are rapid cyclers. Lithium's not a good fit for them, and they often defer to the agent of choice, which is Depakote, for their management. I like lithium in adults. Depakote is effective too, and Depakote is faster to act. I don't want to be waiting 5 to 14 days if one is in a manic episode. So the fact that lithium takes effect slowly can work. In Mike's case, He was not in a manic episode, but he had a strong history of having them several times a year. So I caught him in a period of pseudonormalcy. We started him on it then, of course, as preventive for the next manic episode. And this is the recommended lithium monitoring there.